Hi, everyone. I'm Elaine Quijano. Thank you for joining us. The U.S. has surpassed 500,000 coronavirus deaths. That is the highest COVID death toll in the world. It is also higher than the combined American combat death tolls in both world wars. President Biden on Monday ordered flags at the White House to be flown at half-staff for 5 days. Earlier, he led the nation in a ceremony paying tribute to the lives lost.
The people we lost were extraordinary. They spanned generations. Born in America, immigrated to America. But just like that, so many of them took their final breath alone in America. As a nation, we can't accept such a cruel fate. While we've been fighting this pandemic for so long, we have to resist becoming numb to the sorrow. We have to resist viewing each life as a statistic or a blur or on the news. We must do so to honor the dead, but equally important, care for the living, those who left behind.
Meanwhile, the race to vaccinate has reached a new level of urgency. New strains of the virus continue to spread, and the U.S. is playing catch-up after last week's winter storms delayed vaccine shipments to all 50 states. 75 million doses have been delivered so far. More than 44 million people have received at least one dose, and more than 19 million are fully vaccinated. Carter Evans begins our coverage from Los Angeles.
A somber day marked by silence. Tonight, President Biden and Vice President Harris are paying tribute to the 500,000 American lives taken by the pandemic.
The people we lost were extraordinary. It's our fellow Americans, it's our neighbors, our friends, our mothers, our fathers, our sons, our daughters.
As if nearly every single resident in the city of Atlanta suddenly vanished. Tonight, the bells tolled at Washington's National Cathedral as they did when 200,000 died, then 300, 400, and now 500,000. The toll felt early on by Newark physician Dr. Chris Purnell.
It's like the epicenter of the pandemic landed on me personally.
She lost her father, a scientist, as COVID overwhelmed New York. Since then, she volunteered for the Moderna trial.
I did a screening in my office and I said, Daddy, I've become a data point. And that was the best way I could pay his legacy forward.
Tonight, the CDC is reporting at least 44 million Americans have received at least one vaccine dose. Nearly 20 million are now fully vaccinated. But delays persist from the storms that swept through the South last week and paralyzed major shipping hubs. And supply-related delays could keep coming as New York prepares to open a site in Brooklyn targeting minority residents.
This nation does not have enough supply of the vaccine, period.
Dr. Purnell has dedicated her career to helping underserved communities inspired by her father.
Do you believe systemic racism played a role in his death?
Definitely. I want people to understand that, yes, it has been a staggering death toll, but it has been devastatingly disproportionate on Black and brown shoulders.
For her, today is about reflection.
Here I am on the front lines. We haven't even been able to properly grieve. I watched my father be buried through videos.
Now, this particular vaccination site is located in a heavily Hispanic area of Los Angeles. And in the weeks since they've been open, they've given out 28,000 shots. But now they're ramping it up even further and preparing to give up to 6,000 shots a day. Elaine?
As mentioned, more than 500,000 Americans have lost their lives to the coronavirus, and CBS News is learning more about who some of the victims were and the loved ones they left behind. Nikki Batiste has some of their stories.
He was just so full of life, just always smiling.
Dada.
My best friend, I miss him so much.
Michael Riley died from COVID-19 at age 47, hours after a final FaceTime call with his wife and 2 young children.
He just kept saying, "It's okay. I'll see you soon. It's okay. I love you." That's the last thing he said.
It was just 2 weeks before Christmas.
It's indescribable, the pain I don't know if you still get it feels like you're literally being punched in the stomach. Wait, go around, go around.
It's a pain she shares with Pamela Addison and her children, Elsie and Graham.
Now Elsie will look up at the sky and say, Papa's up in the sky.
Their dad, Martin, lost his battle with the virus last April. He was 44.
So I decided to create a Facebook group because there wasn't one. And especially for young widows, because we have the challenge of having young kids.
It's just like everything is a mess right now with the girls.
The group, now 400 strong, meets twice a week on Zoom.
You took my daddy, now you took my husband.
65% are survivors of color.
My husband was Brian.
Families disproportionately hit by the virus.
My husband's name was Casey.
If it wasn't for this group, I wouldn't be okay.
Aww.
Michael and Martin cherished being fathers.
You can spread it around.
And now our kids are going to have friends that will understand what they went through.
An unexpected family.
Yes.
Yeah. Pamela and Rebecca told me they hope no one else needs to join their group of widows. But the CDC is forecasting nearly 60,000 more Americans could die from COVID-19 by mid-March. Elaine?
Nikki Batiste, thank you. For more, let's bring in physician and immunotherapy scientist Dr. Leo Nissola. Doctor, welcome. Good to see you again. So, more than 500,000 deaths in the United States. How did we get to this point in the pandemic, and what's important to keep in mind as we move forward?
It's devastating. I love to come here and have some happy news to share, but 500,000 people that have left us in the past year is heartbreaking to us all. As President Joe Biden mentioned, they were people that had dreams. Some of them were immigrants that spent their whole lives trying to reach America and pursue their American dream, and unfortunately fell ill to this virus. So these numbers are tragic. It's a moment for us to stop and think about our actions from the past year and how do we move forward here. As someone mentioned on the clip that you just played, we have not had time to heal yet and to fully digest the troublesome numbers and reality that we have been living through the past year in this pandemic. As I told you, I've lost a loved one for COVID as well, and I didn't get to say goodbye, and that hurts.
I'm so sorry for your loss, Doctor. It's something that I think for so many Americans whose lives are profoundly changed, it will stay with them forever. I want to ask you about something that the former head of the FDA, Dr. Scott Gottlieb, says about the current downward trend, saying that is likely to continue, this downward trend in infections. Is that something you agree with, Doctor? And if so, why?
Well, we have a couple of things in play here. Number one, as we are seeing this downward trend, cases are still really high. So I was a little bit concerned when I saw a lot of optimism online today in this very green moment. But also, I saw something else that caught my attention was that New York is planning to reopen movie theaters and allowing for indoor businesses to reopen. So one thing that I want to have a conversation about is if governors are trying to show that they're serious about saving lives, that they should not be considering reopening theaters, which are, we know it's poorly ventilated. It allows for people to be sharing their air indoors and putting more people at risk. You see, the average citizen will walk around town and see a movie theater open and assume that it's safe. Let me be clear. There's no safety in movie theaters today. We still have a long way to go. As we've talked about before, our priorities should be getting shot into arms and ensuring that the population understands the safety of these vaccines and are willing to be vaccinated. So at this moment, where we have a very large number of variants that are community spread already, and we have this grim milestone of over 500,000 lives, many of them who are from underserved communities and communities that were working in essential businesses to make sure our society functioned for the past several months. It seems to me disrespectful to allow movie theaters as your priority, as in a moment where we have not yet allowed fully kids to go back to school. We have not yet immunized our teachers, and our healthcare workers are still struggling to find PPE. So for me, today, it's a moment of realigning priorities, reassessing our strategy, and understanding what the future holds and what kind of future we want to walk into.
Part of the reassessing has to do with looking at the system as it exists, and the pandemic has highlighted existing inequities in the U.S. What have you found to be some of the hurdles that minorities are facing during the pandemic, especially when it comes to vaccines?
Well, it's really hard to find a vaccine appointment in some places. While we're trying to get the standardized vaccine process in some counties and some cities, some states are very difficult. You see, and I'll give you an example of Chicago. If you go to the Illinois Health Department and try to book an appointment online, you would see the challenge of not only finding the fields to do so, but also takes you to a third-party website where you then have to create an account and input your information and try to book an appointment. I tried to do that for a loved one. And let me tell you, it wasn't easy. So while we're trying to get our most vulnerable seniors that are 65 and older, trying to get vaccinated and still putting so many steps in order for folks to be able to do so, it's complicated. Another layer there is that underserved communities are also not tech literate at sometimes. And Wi-Fi access and internet access is not standardized across the country. So when we talk about hard-to-reach communities, indigenous communities, communities that are far and remote from the big centers, they are still struggling. And the reports that I've been seeing is that the vaccine delivery and distribution has not been standardized. So I am concerned.
Well, before we let you go, Dr. Anthony Fauci said Monday the U.S. should not only prioritize national production and distribution of vaccines, but also global accessibility. Why is that important that this be a global effort?
That's right. He's right once again. We should think about this pandemic as what it is. It's a global event. As long as we have hotspots, hot zones, places that we have uncontrolled outbreaks, we will remain in this very vigilant state that we want to get rid of. So the sooner we get to a point of understanding that we need to take this collectively and marshal a collective response against this virus in order for us to reach a place of safety that we can travel again, see our loved ones, and ensure that every community has access to the vaccine, the sooner we'll be able to get out of this crisis. So yes, it's a global event, and we need to tackle it globally.
Dr. Leo Nissola, doctor, thank you very much.
Thanks for having me.